Katie, why don't you talk about your experience? I know it's been a while.
It's been a while.
But why don't you talk about your experience with the GLP-1?
Yeah, absolutely. So when I first decided to take control of my health, I went to my regular doctor and they had sent me a referral to a weight loss specialist. And I met with him. And at the time, insurance wasn't covering anything, whether it was the injections or the weight loss surgery. And he said that he was able to get samples of, at the time, the first one I did was Ozempic. So basically, we were going that route and not jumping to surgery. And I ended up being on weight loss injections for, I want to say, a total of 10 months before I decided to have bariatric surgery. And for me personally, it was just the financial aspect. Because when it came down to it, my insurance didn't cover bariatric surgery or the weight loss injections. And for me personally, the weight loss injections weren't helping. So I had to figure out what my next step was.
Thank you so much for that perspective. And hello, Dr. Choi, you made it. Woo-hoo.
Sorry about that. Hi, Dr. Smith. Hi, guys.
Hey, how are you, man?
Good.
Good to see you.
Good.
We're so glad that you're here. And I know that this subject is very close to your heart. So just to kind of like let everyone know a quick, like don't give us the like long version. Give us a short version about like your background and who you are, where you practice out of, so they can know that you're not just some person, speaking not from experience, but you're an actual expert. Okay.
All joking aside, so I did my fellowship at UC Davis with Bariatrics MIS in 2005, 2006, and I've been very fortunate to practice here in Miami, Florida for about 20 years. And it's been a great road traveling down this journey to help people who are fighting obesity, and it's a pleasure to be part of POP recovery systems, and I would do everything to help you and Dr. Smith and everyone else that's collaborating with me to fight obesity.
I love that, and that's near to your heart too, right, Dr. Smith? Fighting obesity is that's like your number one mission, it seems like.
Yeah, I mean it's what we do. Just like he said, it's somebody the other day said something about my response to it might have been a post or something about a patient that had bariatric surgery, and they said, I didn't know that you did their surgery. And I said, I didn't do their surgery. And they said, well, you almost were like defending them. And I'm like, because I feel like I'm an advocate for everybody who battles this, whether they're my patient or not. It's not, well, unless you're my patient, I'm not an advocate for you. I'm an advocate for anybody who deals with the disease that we try to treat the best that we can every single day. And so I think many of us are like that. Those are the kind of people that we want to partner with POP. It's not just about, hey, how many patients do I have? What can we do to make an impact in this epidemic that we have of obesity, regardless of what treatment option that they need, and regardless of who ends up being the physician that gives them a medication or surgery or the support system for the rest of their life.
Awesome. Now I have a question from the doctor side. We heard from Katie's side that she was taking it, like when she added up the cost, it was much more, just based on results, on finances, it's better to have the surgery. I have taken Ozempic, and the first time I took it, a little bit of like guidance, I guess, from a doctor. I lost more weight, right? But then when I was like, okay, I get it now, I'll just take it myself, because you can just buy it now. I'll just take it myself. I didn't really see those results. Do you think that, or from your experience, is it the guidance from a doctor that helps with the weight loss? Do you have to take like a certain amount and all of that? Like, how does that come into play? Because now people are like, oh, I got a prescription, I'm just going to go to Costco and buy it. And they're just taking it on their own. And like, it was really crazy, because it wasn't until I like started working with a nutrition coach and mixing that with my fitness that I started to see more results. But at the same time, like with the constipation and stuff like that, I was like, is this worth it? Like how much I have to pay to do this. So those are just like my own personal experiences, but I'd love to hear, like, why does it seem like it works sometimes and it doesn't other times?
Yeah, I'll let you go first, Dr. Choi, and then I'll chime in.
So thank you, Dr. Smith. So basically, as you know, that GLP or semaglutide is a GLP agonist, so it mimics one of the hormones that's in the body. So it can affect the brain, the pancreas, and the intestines. So what you were feeling, Miss Alexis, was because it slows down the motility of the GI tract, meaning from the stomach all the way, so you would get constipated. And so sometimes also by taking these medications, we really don't know what dose, to start off with. So you might have not hit your sweet spot. So therefore you hadn't met that sweet spot of milligrams to affect you properly. But that's my little tidbit of what the GLP agonists, and I'll let Dr. Smith go on, take the baton from here.
Yeah, I think that's a good overview of how it works, because a lot of people are on the drug and they don't understand how it works. And I think from a surgical standpoint, I always tell patients, I want you to understand how your surgery works, because if you understand how your surgery works, you have a better chance of being compliant. If you don't know how your surgery works and you just say, well, I trust you, just do whatever you need to do to me to help me lose weight, then when you have what you think are side effects, you don't realize that they're actually secondary to the fact that you've had this surgery, that they will pass. And there may be some behaviors that you're doing that can control those, what you think are side effects, but are normal based on the surgery that you've had. So I think it's really important that people understand, how does this work? And, oh gosh, I'm nauseated because my stomach's not emptying very well. I think the reference that you made about the cost, it's true. If you look at the average cost of bariatric surgery, in about a year and a half of what you would pay for the GLPs, you've paid for your bariatric surgery. I think the other concern that we have for the GLPs is how they've got into the hands of anyone who has prescription writing privileges. The studies on the GLPs were done when there were lifestyle changes and regular follow-up and monitoring performed. And so, for example, something like Zepbound, which is the Mounjaro that has the indication for weight loss, it's the one that's posted the highest percentage of weight loss, possibly as high as 18 months. Now, that was 18%. That was at 78 months. But what the studies are very clear is, as soon as they went on placebo, they went back on basically saline injections, but they didn't know they weren't getting the medicine. The majority, 85% or greater of those patients gained the majority of their weight back. Now, the only way they did lose weight was if they had dietary education, mental health support, overall, let's just generically call it lifestyle changes in place. So when people hear those statistics, all they hear is 18%. And they say, okay, so give me the drug, just like I take my blood pressure pill, I'm going to have 18%. Early on, you will have weight loss because you're going to be so nauseous, and you're going to have some of those, whether you call them side effects or actual effects of the drug. But those patients long-term statistically have been shown to fail if they don't have that support with it. So it's not to say that myself or Dr. Choi is smarter than everybody else and we're the only ones that should be giving these drugs. That's not the case. But if a primary care physician is giving these drugs, they have to be providing that support long-term for the patient. They're called lifestyle changes for a reason. They're for the rest of your life. Just like on the flip side, me as a bariatric surgeon, if I'm just handing out the script once a month and we're not providing that support, we're setting our patients up for failure as well. So these are all the things that you have to talk to a patient about when they come in, is you have to say, you need to know what you're signing up for. And here's the things that we always make sure we make clear about GLPs. Number one, do you know for sure you'll keep the job that you have for the rest of your life if you have an insurance that is paying for them? And no one knows that, right? So if you switch jobs and you no longer have medical weight loss benefits, you may go from paying $100 a month to $1,200 a month. Versus if you change jobs 2 years from now and now your new insurance doesn't provide bariatric benefits, they can't go in and reverse your surgery. Your surgery's already there. Your tool's already there permanently. So we need to make sure, do you understand the ramifications of what cost may be moving forward? Number two, do you know that you're signing up to take this for the rest of your life if you want to achieve the results that the studies are posting and the drug companies are showing? And if people understand that, then hey, and if they're a good candidate for a GLP, then that's the direction that we'll proceed.
Yeah, and I think that's really important to know the different options so that you know which one is best for you. I would love to ask Katie, because I know that you took the drug for like 10 months, right? Through that process, did you feel some of the side effects? Did you go through some of the side effects? Could you explain like what, and like I said, I know it's been a while, but to be honest with you, I doubt that like the chemistry of the drug changed. It's Ozempic is Ozempic, but I
Yeah.
could be wrong. I'm not a doctor, but like,
No.
could you talk about like that, your
Yeah.
experience with that, insights?
So in the beginning, I was on Ozempic, and then halfway through, they switched me. I always pronounce it wrong. Is it Wegovy? Wegovy?
Wegovy.
So then I was on that one as well. Why did they switch? Honestly, I think it was because of how accessible it was at the time, because I was doing samples. So my doctor was able to give me a sample for however many months, and then it stopped. And he's like, oh, well, now I can do this. Here's this. And then I think I did like a discounted program where it was like $25 a month, but then that stopped. And then they're like, oh, it's going to be $1,400 a month now if you want to continue it. Well, before it had gotten to that point, I was experiencing a lot of nauseous, like I was wanting to throw up all the time. I couldn't hardly eat. I was having severe stomach issues, going like running to the bathroom. And then brain fog. I don't know if that's a side effect of it or not, but I was in some sort of fog at all times. And then at one point, I can't even honestly remember what it was, but I landed in the emergency room. And the only thing that had changed was my weight loss injection. And I was getting ready to have to administer my next dose like the following day. And with it being on a weekend, the emergency doctor looked at me and was like, honestly, I know nothing about those drugs. So I would just go ahead and do your injection if it's scheduled tomorrow, and then call your doctor when they open on Monday. And I was like, well, I just think I'm not going to take it. And I took myself off of it. I didn't give myself the next dose. And then I called my doctor the next day when they reopened. And that's when we had the discussion of, hey, is this something I'm going to continue doing, or what are my next options? Because I was tired of I was sick and tired of being sick and tired. And over that 10 months, I hate the word only, but over that 10 months, I had lost 20 pounds. And they had even expected me to lose more. So yeah, it wasn't for me. I know it works for some people, but I wanted more of that long-term solution. And thankfully, because I did go through a weight loss specialist at the time, like they did have that nutritional support. Like I still met with a dietitian every couple of weeks, and had that follow-up. But I know, like you were saying, Dr. Smith, if you go through your primary care, they don't always have that support. And you have to have that support to continue on your journey, or you're left with no information. And it's just setting you up for failure.
Right.
It really is.
Yeah, and I think that people need to be careful of how much they learn about these drugs on social media, because just because like I'm taking them, like I have a box of Ozempic in my refrigerator right now. I could start a live and be like, okay, everybody, we're going to talk about why you should buy Ozempic. And I could like wear a doctor's coat and sound super smart, go on ChatGPT, give me 6 points about Ozempic, repeat them to you, and I sound like an expert. And how do we not know that that's not what these people are doing? Like, I really believe that if you guys are going to suggest these kinds of drugs, or if you're going to explore these kinds of drugs that you're going to put into your body, don't just talk to your PCP who may not know too much. Find a weight loss specialist. Find a bariatric surgeon in your area. Not to have surgery, but I'm sure he knows about it. Would you say, doctors, that it's safe to say that most bariatric surgeons know about this drug and the of it?
I would, and I think the best example I can give you to reiterate the point that you just made, which is very good, is so people who are wanting treatment for their obesity, I mean, think about how Katlyn, think about how many times you got so tired of people just assuming that you eat more than they do, and that's why you were obese, or that you were lazy, or that you didn't put in the work. It's nauseating. So most people who battle with obesity, they're looking for somebody to stand up for them and fight for them and say, this is a disease. And I think we're starting to realize and see more people understand this truly is a disease. Sure, there's things about our behavior that we could change to make our disease more treatable, but it's a disease. But you can't be one of those patients that says, I'm tired of doctors not looking at this problem of obesity as a disease, but yet want to wing it and do it on their own with medication. Because if a patient says, I have the disease of hypertension, they would never go somewhere and get a compounded hypertensive pill for cheaper, because they can get it cheaper that way, and wing it on their own. Take the medication. No one's checking their kidneys. No one's checking their blood pressure. No one's checking what's happening to them. They would never do that. Well, then you can't have this is a terrible pun, but I'm going to say it anyway. You can't have your cake and eat it too.
Sure.
You can't say, I want you to treat this like it's a disease, but yet I want to treat it like it's not a disease, and I want to wing it on my own and be my own doctor. You can't do that. And so if we're going to say this is a disease, let's treat it like a disease. Let's get you in the hands of someone who's a specialist with your disease. And don't get me wrong, there are plenty of PCPs out there that are very good obesity medicine specialists, that they focus on this, they do this, and they understand the importance of all this. And there's some bariatric surgeons who don't want to fool with it, and that's okay. They don't have to, but you can't halfway do it. So that's why I think it's so important that if you're going to say this is a disease, which it is, treat it just like any other disease you would. And it has to be done the right way, monitored by a specialist who knows about it.
Well, if I can just chime in also, I just wanted to tell you that Dr. Smith brought up a great point. The treatment for obesity, in my opinion, and through the NIH, is surgery. The prevention are these drugs. Yes, I understand that if you're unable to get into or unable to pay for a bariatric surgery, I get it. You're doing something to help you. But hopefully that POP recovery systems will allow us to help those people and get into those, as what Dr. Smith is saying, the treatment for obesity is surgery. Because as he said, there's an 85% recidivism, meaning that you will gain all your weight back and even more once you stop these drugs, or you're unable to get those drugs due to your changes and economic changes that you're going to see.
So there was an interesting study. We just talked about this the other night. My CEO of my hospital brought it to me a few weeks ago, no, a couple months ago, I guess, but up in the state of Michigan, there's a large insurance company that did not currently cover bariatric surgery benefits. But they were providing medical weight loss benefits. And they sat down and they looked at the amount of money they were spending on medical weight loss since the GLPs came out. Because we just went from people spending money on maybe phentermine, which is dirt cheap, to GLPs, which is extremely expensive. And none of these drugs are anywhere close to patent running out. So they're going to be expensive for a really long time. And what happened is they looked at it and they said, we now need to start providing bariatric surgery benefits to our patients, because we are spending so much money on these drugs. We can, in a much more cost-effective way, give them the actual treatment of obesity, just like Dr. Choi says, accomplish a significant amount more weight loss and long-term weight loss that's been proven not over 78 weeks, but over 10 years plus. And so they've shifted. And so it's been very educational for some of these insurance companies to say, wait a second, this opened our eyes to the problem, but there's been a solution right under our noses for years, and we assumed that it wasn't the ideal one, and now they're realizing that.
And I want everyone to know that you can put your questions in the little question box. Just please put Katie question, and then, or Dr. Smith question, or Dr. Choi's question, so I know who to ask. But one thing that I want to jump to, and Dr. Choi, you just tapped into my personality. Like, you just said what I've been thinking, like, but I don't feel like I can say it because I'm not a doctor, you know what I'm saying? So, but you just said it. And I kind of want to talk to Katie because she's the patient on here. Like, she's been through both, you know. how did you feel like when you were making that decision to switch from the medication to the surgery? What were some of the thoughts that you had? Was there a fear that you would only have like, yeah, girl, be honest, but
I love Sylvie.
I know you will, girl. That's why I love you. So for those 10 months, you lost 20 pounds. Like, and I'm not saying that the number is so important, but it's like, that is one thing that's measurable that you can say, is this working or not? How did that compare in your first 10 months of bariatric surgery? And what were some of the thoughts in that transition? Because you tried one and then you switched to the other.
Yeah, absolutely. So for me personally, surgery's terrifying. I don't care what kind of surgery it is, it's terrifying. And I wasn't mentally ready to go through that route. That's why I decided to go with the injections first. But see, for me personally, I had insurance who didn't look at obesity as a disease. I called them and I was asking about my benefits, seeing if weight loss injections or bariatric surgery was going to be covered. And they said, no, we don't cover anything weight loss related because obesity is not a disease. It is a self-driven disease. And I was like, okay.
Wow.
So yeah. I said more than that, but I'm not going to say that on here. So that's why I did that. Well, then the samples, okay. I'm like, okay, well, it's free. Like, I'm going to try this. I'm going to run with it and see if it works, because in the moment, financially, I didn't think that I could afford to have bariatric surgery. So I went that route. And then going through the path that I went through and just feeling overall like complete shit, I was like, I can't do this long term. Okay. So for me, I said, well, you have two options. Well, maybe more than two. You do the injections and you pay $1,200-$1,400 a month, and you maybe get results or you maybe don't. You take out a loan and get bariatric surgery and go that route, or you just give up. You just stop. Because for me, when I was doing the injections, I was doing everything right. I was meeting with a nutritionist. I was doing all of the things right and not seeing the results. And I felt defeated. I thought I was going to stay obese the rest of my life. Well, I went and I applied for a personal loan, and it was literally, I was waiting by the phone. If I get approved for this loan, I'm going to have the surgery. If I don't get approved for the loan, I'm done. I'm just, thankfully I got approved, and that's how I paid for my bariatric surgery. And I mean, I know it's all about results, right? But it's that long-term thing too. I mean, I was fortunate. I did lose my weight pretty quick. Some people are slower losers, which is completely fine. Like I say all the time, you didn't gain all your weight overnight. You're not going to lose all of your weight overnight. It's not a race to the finish line. This is a lifetime commitment. And thankfully I've been successful, but that's a summary. That's the story.
No, I appreciate that so much. Dr. Choi, I have a question for you.
Okay.
Why do injections stop working after you stop taking them? Was it about them what is it about them that makes them set up for short-term success versus long-term success?
So that's a great question, Miss Alexis. So as you said, the semaglutide is a GLP agonist. So basically, it mimics a hormone that's in the body that prevents you from feeling hunger and slows everything down. So if I get your question right, is once you stop taking it, guess what? It goes away. And so your own natural body just starts going back to where it was, because as I said to my patients, everyone has their own little air-conditioned thermostat in their brain, and that's where they're set no matter what. And so basically when you stop that, Miss Alexis, that's when everyone goes back to their natural ranges, and that's when you start gaining all your weight back.
Okay.
Yeah.
And
I think the easiest way to think about it is just there's no other drug that anybody would take for blood pressure or diabetes and take it for 3 months and then decide to stop taking it, but their problem's fixed for good. Yeah. It's really no different than any medicine that we take for anything. I think there's also something that you have to consider is that you have, there's a thing, what many people don't know is if you have bariatric surgery, it mimics as if you're on a GLP. There have been studies we've known before the GLPs came out that people who have bariatric surgery, and specific surgeries more so than others, we see increased sensitivity of those GLP receptors and GLP levels. So it's almost like, and there was a great post a few months ago of an obesity medicine specialist who focuses on GLP administration of the medications, who admitted, yes, surgery is almost like mimicking GLPs. But when you stimulate a receptor over and over and over and over and over again with a medication, your body many times says, maybe I should downregulate these receptors because this seems abnormal. Just like if you block a receptor, it will upregulate those receptors to try to override the system. So now you've downregulated the receptors from being on a GLP. Now you take the GLP away and you're less sensitive to that hormone that your body makes of inhibiting your hunger and things like that. So it's a lot of science that some people may not want, but just think of it this way. There's no other drug that you can take and just stop and your problem stays gone.
And I think that there is one question for you, Katie. Which surgery did you have?
I had the gastric sleeve.
All right, so yeah, the gastric sleeve, Flores, E. Flores. And so I really want to I want everyone to understand that we support your transformation journey no matter where you are. But there is a right and wrong way to use these tools. So for example, the way I was doing it, just doing it myself. Okay, Google says start with 0.25 for 4 weeks, and then go up to 0.5. Then go up 0.75. This isn't working. I'm going to skip to 2. That's not the way to do it. And whether you have at that time, I have my nutritionist, I have my mental health, but I don't have my surgeon, right? So none of it was working because I wasn't doing it right, And the same thing with bariatric surgery. And 50% of that is finding, anyone can be successful with the tool, but like a huge percentage of that is finding the right surgeon and the right practice who has comprehensive support to be able to give you the tools from the beginning to help you get the most out of that. And one of the reasons that Dr. Choi is here with us today is that he has, after 20 years of all this experience, seeing so many patients, decided that, yes, this pop recovery systems and putting it into his practice and giving his patients this comprehensive support, this made sense to give them the best results. And so because I have 2 amazing surgeons on this call, I want each of you to answer me. What is the difference between having bariatric surgery, and Katie, you're going to go after them. What is the difference between having bariatric surgery and having the normal, not calling it good or bad type of support program, and going through bariatric surgery and having more an in-depth, individualized support program like we have here at POP, from the surgeon's perspective?
I'll let you go first.
You want to go first?
Yeah, I'll let you go first.
Thanks, Dr. Smith. Oh yeah. So, out of respect for Dr. Smith, I'm not gonna go. So, just anyways, what I would think is that honestly, when I first was introduced to Pop Recovery System, and I knew that Dr. Smith was the director, and I'm not trying to kiss his butt or anything. I just knew that he was just. I understood his practice from long time before, and then I understood what you guys wanted to do, and there's been so many times where I can't do it. I can't be the nutritionist. I can't be the psychologist. I can't do it. I want to, but there's no way. There's not enough time in the practice to do that. And I think that what you guys and what you're dreaming and what you're setting for in the journey, I think is just very important, because it's going to help a lot of people, because we always get questions. I'm sure Dr. says, hey, what do I eat now? Or what can I do this? When can I exercise? When, and what are all these questions? And if you multiply that by so many patients, there's no way in God's good earth that you're going to be able to answer all those questions. And that's why I believe in this system and what you and Dr. Smith and Katie are all trying to do.
Yeah, I would say that you'll not meet an experienced bariatric surgeon who has a comprehensive program that would not admit to you that a multimodality approach of mental health, dietary education, lifestyle changes, and good surgical care is not mandatory for good results. And if you ever met one that says that they aren't, then no offense, they're not a good bariatric surgeon. But you won't, you really won't. Whether they want it, whether they're utilizing POP right now or not, they will always admit that. They will, number two, always admit that they wish they had more resources to do those things. But whether it be the cost of carrying that overhead, whether it be having access to people around them that do a good job, or not knowing maybe some people who are specializing in that. And I think what something that I've really tried to follow over my career, especially as I've progressed through my career, is the key to success is to surround yourself with people who are passionate and very good at what they do. And there is none of us in this world that are good at everything. And sometimes as physicians, we tend to think because we're the physician that we're where the buck stops everywhere. And I think earlier in my career, years ago, when I learned that as long as I help the patient, it doesn't have to come from me. It can come from someone else in my office or someone else, because I want the best of the best at their specialty. I want the best of the best at something that they love, that they're passionate about. I'm really passionate about what I do, and that's part of why I'm good at it. But other people, our nutrition coaches, our mental health specialists, our concierge people, our ambassadors who have been through this, like Katlyn, who have been through this and is so passionate about wanting everybody else to experience the success that they have and to get through those tough times when they have them too and know that it's normal. They all get to focus at what they do really well. And we just become a team. And it doesn't matter that I did everything, or Laura did everything, or Katlyn did everything, or Dr. Choi did everything. We did our part, but we know when a patient uses this program, they are surrounded by people who are experts and very passionate about what they do, and we're covering all those categories that are mandatory, that all those surgeons will admit are necessary for people to be successful.
Absolutely.
And Caitlin?
So I will tell you firsthand, support has been probably the only reason why I have been successful. I can't tell you how many times that I just wanted to stop, that I wanted to give up. We say this all the time, and I mean it from the bottom of my heart. This surgery is a tool, and if you don't use your tool the way that you should, you can potentially not be successful. You can gain it all back. What is so different, and I say this all the time, you need food to survive, unlike any other addiction. You don't need alcohol to survive. You don't need drugs to survive, but you need food. And changing your relationship with food is not easy. I'm a recovering food addict. There are still days that I struggle, but having that help with a nutritionist, having that help with a mental therapist to find out like other ways to not use food for therapy has been so helpful in this journey. Because without it, I can't say I would be standing here saying that I'm a successful story. Because I don't know that I would be if I didn't have that support.
I love that. Thank you for being so honest. So I do have a question for Dr. Smith. What advice can you give for women who are going through menopause after having the sleep? Basically, the weight loss has stopped.
So what you have to understand with conditions like menopause, for example, or we'll say hypothyroidism, there's some other things too that many people will associate with weight gain or plateauing of weight loss, is those things will impact the way your body breaks down calories in your metabolism, but those things will not directly cause you to gain weight. Let me explain. I wish I could eat what I did when I was 40, but I can't get away with it. And now that I'm going to be 50 this year, and Laura's never going to let me forget that. She calls me old every day. I can't get away with it because my body has changed and it's different. If I don't change my activity level, if I don't change the types of foods that I eat, if I don't change my calorie number, then I may be staying the same on what I'm taking in, but I may be gaining weight because I'm breaking food down differently and I'm burning calories differently. It's also really important that we focus on our body composition, maintaining muscle mass. And so as we get older, we struggle to maintain our muscle mass. And as your muscle mass drops, the number of calories your body burns drops. So if someone's slowly losing muscle mass, their calorie number slowly drops down, and you're still eating the calories that used to work for you 5 years ago or premenopausal, and now they're not working anymore. So I'm not an OBGYN, and I don't pretend to be, but I can tell you that you can overcome it. It's not a hindrance to weight loss, but you need to sit down with somebody and really dig deep and make sure your hormones are maximized, make sure your body composition is maximized, and let someone help you with it.
Thank you so much. How about Katie? What advice would you give to someone who's getting ready to have surgery on May 29th?
Where should I start? Take pictures, take videos. Remember, it's not a race to the finish line. You're gonna have good days and you're gonna have really shitty days. That's just the reality of it. Okay. Do not compare your journey to other people. Listen to your doctor, because what you're gonna find out, especially if you're on the internet, is everyone's doctor will tell you something different. Some doctors tell you no caffeine. Some doctors tell you no straws. Some doctors tell you just got to make sure you're following your plan, because everyone is going to be on a different plan. Stay off the scale. Your measurements. I can go on and go on and go on, but I'm going to stop right there.
Yeah.
Awesome. Question okay, let me make sure I do this in order. Dr. Choi, what are the bariatric surgery benefits? Can you give an explanation on what we should be looking or asking for?
In what aspect? Meaning what
Like
each surgery does?
going patients, so to speak. That's what I suppose. When they're going, what should they be looking for? So the first part of the question was, what are the benefits of bariatric surgery?
So the benefits of bariatric surgery are, as you see, you can have, if you have if you have hypertension, diabetes, cholesterol levels, you have a 70 to 80% chance that your hypertension and type 2 diabetes will resolve. You also have a 70 or 80% chance that if you have a CPAP machine or sleep apnea machine, you might throw away in the garbage 6 to 9 months later on down the road. In addition to that, there are good things about having each surgery is different. I like to do the gastric sleeve as Dr. Smith had said, because it does affect you hormonally, because when you cut and remove 70-80% of the gastric sleeve or the greater portion of the stomach, you also remove this hormone called ghrelin. So we also know that ghrelin and leptin are these circadian rhythms that go up and down that make you get hungry. So sometimes what my patients tell me after gastric sleeve is that I'm not hungry anymore, Dr. Choi, so that I forget to eat. So that's a good sign that for me that I've been successful, that I've done a good surgery for the patient, so that makes me feel well. The other thing about the bypass, really quick, it also does a great job, but it's also twofold, because it is malabsorptive and restrictive, meaning the pouch is the restricted portion and the bypass is the malabsorption portion. So some people like to do that, but each doctor, as you said, Dr. Smith might want to choose one or the other, but I preferably like to choose the sleeve first, because then, God forbid, down the road, there's more options to switch it into a bypass or CDS or duodenal switch. But not saying that the bypass shouldn't be done in the first place, but that is just my feeling as a surgeon, and other surgeons might have different values and beliefs on what surgery they like.
Thank you. And Dr. Smith, does RNY treat the disease of obesity?
Yes, absolutely. Room-wide gastric bypass, we have as much data of any of the surgeries out there, long-term data. Room-wide gastric bypass is a great procedure if it's done on the right patient. There's no perfect procedure, but room-wide gastric bypass has been shown to have significant weight loss over long-term. And so all of these surgeries we're talking about, DS or duodenal switch, SADI, gastric bypass, sleeve, all of these or surgeries that treat the disease of obesity. But I always like to tell patients, you may, on your history in the chart, it may say that you have hypertension, but when we check your blood pressure, it's normal. The difference is you take a medication for your blood pressure. That's why it's normal, but you still have the disease of hypertension. What I like to tell people is mentally, you always have the disease of obesity, but it's now permanently controlled. And what that does is it keeps you on guard, not only of behaviors, but it keeps you on guard of follow-up and having long-term plans to keep you on track. People who've had cancer, they're cured of their cancer, hopefully, but they're still going to follow up with their oncologist to make sure that there's no evidence of the disease coming back. And obesity really isn't any different. Of that long-term follow-up, that long-term plan to make sure that you keep your disease at bay.
Thank you so much. So, Dr. Choi, how can I continue to lose weight after 1 year and a half? Like, she's not losing weight. It's been 1 year and a half. Like, she stopped losing weight. Is there a way to continue to lose weight after 1 year and a half by changing things around?
Yes, so depending on what surgery, but there are some times that that what we need to do is you need to get a good X-ray history of what's happening, depending on what surgery he or she has had. But then we also gotta see if she's been following up with a dietitian, if she's having support, as we're discussing with all these things, because that's what we're trying to hit upon, that it's so important. Without support, maybe you fell off the wagon. So what you need to do is you need to go and have an examination or have a brief medical history and surgical history redone, get a studies. Maybe you stretch the pouch out. Maybe, there's other factors. Maybe, as you said, you've hit menopause. When women who hit menopause 40 and after, you lose 1% of muscle mass every year after 40. So those are certain things that we need to understand. But it could be simply that, listen, I've been eating a lot, but I don't go and walk after dinner as I usually did. So those are simple fixes. But it should be a whole practical support of what we need to figure out why. What was the main reason why you've stopped losing weight? So that's why this POP recovery system is so important.
And I think that this is a great comment for Katlyn, because you've probably gone through this, talking about how the food noise comes back even after the surgery, right? Why is that? If your stomach's gone, then where did the food noise come from? I know, but I want you to say it.
Girl, I'm not kidding you. And I struggle with it. But I think what makes it different now is that I can recognize that there's that problem. Whereas before, I didn't recognize it. And I was just like, oh, okay, whatever, I can do this. But I don't know, times are different. And sometimes I'll be stressed. And when you walk by that pantry door, it's like, eat me, eat me, eat me. And I have to slam the door and walk straight past. Whereas in the past, I was just like, okay, what you got in there? It's what I like to say, and you guys can correct me if I'm wrong, but I feel like that first year, you're in a honeymoon stage. And then after that first year, it's you having to put that work in. You have to continue the dieting and the exercising and staying on plan, because if not, you can easily go back to the bad habits and gain your weight back. I know people personally, and I think that's why I was so scared at first to do the surgery, is I know people personally who have failed and have gained all their weight back and then some, and then had to go have a revision done. Because people don't realize, they think it's a quick, simple fix, and it's not. It's not at all.
No.
And Dr. Smith, last question. Is it ever too late for a revision?
No. If a revision is necessary, it's never too late. I've revised patients who had their surgery so long ago it was done open. I had a lady not too long ago, I did a revision of this lady who had surgery in the 80s. Now, there's some doctors that are going to feel comfortable doing that, and some that aren't, and that's okay. But it's never too late. It's like life. It's never too late for a fresh start. It's also never too late if you feel like my only option is a revision, to get to a specialist and find out you may not even need a revision. You may just need some education and support. We don't look to do revisions. We do them when they're necessary, but it's never too late. Today is the best day to start all over. And it's never too late. You've not ruined your tool. You've not ruined your chance. You've not missed your window of opportunity, and it's gone forever. Get with somebody, get support system in place, have POP support you. For those of you out there that had surgery years ago and you're like, gosh, that's a lot of trouble to go find a surgeon to sit down with. Don't worry about that. Go to POP first. Sit down with POP, because you may just need POP for long-term support to get you back on track from a dietary standpoint, mental health standpoint, psychological standpoint. But POP can also get you in the hands of an experienced surgeon who can provide those options for you if ultimately that's what you need.
I just want to say something.
Yeah,
No,
Katie.
you're good. I was going to say, and please know that just because someone does your surgery, if they're not giving you that continued support that you need to be successful, there is nothing wrong with going and having that continued follow-up care with another bariatric doctor.
Absolutely.
I personally do not see the surgeon that I had do my sleeve. I am now going to another bariatric doctor because I wasn't getting the support that I needed. And that's okay. You have to advocate for your health because you want to be successful. And one of my first questions to that new surgeon was, how often do you see people, even though I'm now over 2 years post-op? He said, I still will continue to see you every 6 months to a year. I will still do your blood work. I will still do X, Y, and Z. If you need a nutritionist, I've got you. Like, it is okay to continue to seek out help, even though it's not your surgeon.
Yeah. Be your number one advocate. I tell patients that every week. You have to be your number one advocate, and everybody else will fall in line, and other people will see you advocating for yourself, and they'll gravitate towards that, and they'll want to advocate for you as well. But you have to take responsibility to be your number one advocate.
Yes.
Dr. Choi, do you have any last words for our audience?
I think that whichever way that people want to choose to lose weight, if it's financial, economically, meaning that if you can't afford to get weight loss surgery now, don't be afraid to use these semaglutides and these weight loss drugs. But however, just know for the fact that once you stop that, you will gain your weight back. But and the most important thing is hopefully POT recovery system can help you get your financing also to have the surgery done. So don't be scared, as Dr. Smith said. Every day is a new day to change your life, and we're trying to help you guys to get a new lifestyle and change your life so that you can become more healthy for your future.
Love that. Katie, Dr. Smith, last words for the peeps?
No, great seeing you guys. I think it was a great conversation. Look forward to seeing you guys next week.
Just remember, guys, you are worth the investment. Whether insurance covers it or not, you have to.
That's right. Invest in your health.
Yeah.
Invest in you first, and then you can invest in all those fun things that you want to do. But invest in you first so you can enjoy.